You are 58. You are sitting in a clinic hearing words you never expected to be aimed at your own body. Stem cell therapy, regenerative protocol, multimodal erectile dysfunction treatment. It sounds like something out of a science fiction movie. Shockwaves. Stem cells, oxygen chambers, price tag more than your first car, and even if you could afford it, a part of you thinks I do not want to be a lab experiment, I just want my potency back. Here is the honest secret most guys never hear. What those 2025 stem cell protocols are really trying to do is not magic. They are trying to repair the same three things that went wrong in your penis in the first place. The damaged inner lining of your blood vessels. The scarred oxygen-starved erectile tissue, the chronic oxidative stress that keeps killing nitric oxide before it can do its job. And there are ingredients in your kitchen, not a lab, that can mimic those repair signals. Boosting nitric oxide, reducing oxidative stress, feeding the very cells that keep your erection tissue alive. So today, as your urologist, here is the plan, not to sell you stem cells, but to show you a stem cell mimic drink, a daily potency tonic built from nutrients that science now uses as the support team around regenerative ED therapies. It will not replace a clinic treatment if you truly need one, but it can help your penis behave a lot more like a younger man's by copying the same repair mechanisms those expensive protocols target. What stem cell ED protocols actually do under the hood? Let us quickly unpack what regenerative ED treatment means in 2025. A recent multimodal trial took men with stubborn vasculogenic ED, the blood flow kind, and gave them low-intensity shockwave therapy to mechanically stress penile tissue and trigger angiogenesis new capillaries. Intracavernosal and intravenous stem cells to support tissue repair and paracrine signaling. Hyperbaric oxygen sessions to flood the tissue with oxygen and enhance healing. The result, significant improvements in erectile scores and penile blood flow measures without major safety issues. A 2025 narrative review on ED and oxidative stress explains why this works. Chronic diseases, diabetes, hypertension, obesity increase reactive oxygen species in penile tissue. Oxidative stress inactivates nitric oxide and uncouples endothelial NO synthase, destroying the very signal that opens penile arteries. Endothelial dysfunction and redox imbalance are now seen as central, not secondary, in ED pathophysiology. Stem cells, shockwave, and oxygen do not create a new penis. They release growth factors that support new vessel growth and smoother muscle architecture, reduce oxidative damage, help the endothelium recover its ability to make and respond to nitric oxide. Now here's the crucial point. Those same reviews and separate nutraceutical papers also highlight that certain foods and supplements can support exactly those same mechanisms, improving endothelial function and NO, lowering oxidative stress, supporting vascular remodeling and smooth muscle health. That is the biology your drink will be built on, not hype, mechanisms. The 3 jobs of a stem cell mimic drink. A true stem cell infusion does 3 big things locally in erectile tissue. 1. Reduces oxidative stress, so nitric oxide and cells stop getting hammered. 2. Improves endothelial health and nitric oxide signaling so arteries can open again. 3. Supports structural integrity of the corpora, smooth muscle connective tissue and microvasculature. Your drink cannot put new cells in your penis, but it can be built to deliver high antioxidant polyphenol-rich compounds that lower oxidative stress and improve endothelial markers. Supply nitrate and NO precursor amino acids to feed the NO pathway. Provide nutrients that have been shown to support vascular smooth muscle and overall cardiovascular health, the same pipes your erection depends on. Think of it as the daily nutrition protocol a regenerative clinic wishes all their ED patients were already on before they walked through the door. Ingredient number 1, the nitric oxide backbone beat plus citrulline. Stem cell therapies still rely on one thing working. Once vessels are a bit healthier, they still need to open. That opening signal is nitric oxide. 2 of the best studied NO support nutrients for men are dietary nitrate from beetroot and leafy greens, L-citrulline, which your body converts to L-arginine and then to NO. A clinical trial protocol on dietary nitrate and ED is based on the rationale that nitrate from beetroot can increase plasma nitrite and NO, improving endothelial function and potentially erectile physiology in men with vascular ED. Another study gave men beetroot powder with or without L-arginine for 28 days and found improvements in blood pressure and endothelial function markers, especially when both were combined. For citrulline, a small but important trial in men with mild ED, mean age mid-50 seconds, used 1.5 grams per day of oral L-citrulline for a month. 50% of men improved erection hardness from score 3 to 4 compared to only TAR to 4.45. 8.3% on placebo. Monthly intercourse frequency increased. No adverse events were reported. Subsequent studies combining L-citrulline with antioxidants like resveratrol reported further improvements in ED scores on top of standard therapy. Your drink will use a modest dose of beetroot for nitrate, a modest dose of citrulline for arginine NO, enough to support endothelial NO without being a bodybuilder stack. Ingredient number 2, the antioxidant redox shield pomegranate plus berries. That 2025 Oxidative Stress Review on ED makes it painfully clear: if you do not reduce reactive oxygen species, nitric oxide will keep being destroyed as fast as you make it, and stem cell or no stem cell, the endothelium will stay sick. A high oxidative balance score, eating more antioxidants, fewer pro-oxidants, is associated with lower ED risk in epidemiological work. Polyphenol-rich fruits like pomegranate and berries are particularly interesting for ED because they have strong antioxidant capacity. They improve endothelial function and no bioavailability in cardiovascular studies. Higher habitual intakes of anthocyanins from berries and other flavonoids are linked with lower ED incidence. A large prospective study found that men with the highest intake of specific flavonoids, anthocyanins, flavones, had a substantially reduced risk of developing ED, especially when combined with regular exercise. A 2024 paper on dietary patterns and ED reported that diets rich in fruits, vegetables, and whole grains, particularly those providing flavonoids and nitrates, were significantly associated with better erectile function and lower ED prevalence. Your drink will therefore include pomegranate juice rich in polyphenols that support endothelium and may improve penile blood flow parameters, mixed berries for anthocyanins and additional antioxidants. These do not regenerate tissue like injected stem cells, but they do create the antioxidant endothelial-friendly environment those cells need to work and that your own native repair systems can use too. Ingredient number 3, the Cocoa Smooth Muscle Whisperer. Most regenerative ED protocols try to normalize the balance between smooth muscle and collagen in the corpora. Too much fibrosis, not enough pliable muscle, and erections become weak and short-lived. Cocoa flavonols from high-quality cocoa powder cannot remodel corpora on their own. But studies in humans have shown they improve flow-mediated dilation, lower blood pressure modestly, enhance no bioavailability, and reduce oxidative stress. One line of research showed that cocoa flavonols and inorganic nitrate have additive effects on endothelial function, each improving dilation on their own and together giving a stronger benefit. Those are exactly the vessel behaviors, better dilation, smoother wall function that regenerative clinics are trying to enhance with shockwave and stem cell signals. So a teaspoon of natural unsweetened cocoa in your drink is not a dessert. It is part of a vascular signal that says open when you are told stay responsive. The 2025 Stem Cell Mimic Potency Drink Recipe. Here is the full formula put together. You can take it mid-morning or mid-afternoon away from huge meals most days of the week. Ingredients: 1 serving 150 milliliters, about 5 ounces unsweetened pomegranate juice. 100 milliliters water. 1 small handful 1/2 cup frozen or fresh mixed berries. 1/2 to 1 teaspoon beetroot powder. 2 to 3 grams L-citrulline powder, about 1/2 teaspoon, check label. 1 teaspoon unsweetened natural cocoa powder. Optional squeeze of lemon, a few ice cubes, and a tiny bit of stevia if you need sweetness. Directions: pour pomegranate juice and water into a blender. Add berries, beetroot powder, L-citrulline, and cocoa powder. Blend until smooth. Taste and adjust with lemon or stevia. Drink slowly over 10 to 15 minutes. What you have just given your erection tissue, nitrates beat equals nitrite equals no equals better arterial opening as seen in vascular and ED-focused nitrate research. Citrulline equals arginine equals NO equals improved erection hardness in mild ED in human trials. Polyphenols from pomegranate and berries equals less oxidative stress, better endothelial health, lower ED risk in long-term dietary studies. Cocoa flavanols equals improved endothelial dilation additive with nitrate for no mediated vasodilation. That is why calling it a stem cell mimic drink is not magic marketing. It is a shorthand way of saying, we are copying the goals of regenerative ED therapy, more no, less oxidative damage, better vascular responsiveness using food-grade molecules your body already understands. How to use it in a real 30-day potency plan. A drink alone, even this one, will not drag you from zero to hero if you ignore everything else. Every 2025 ED review repeats the same truth. Lifestyle, diet, and risk factor control are not extras, they are central to both non-regenerative and regenerative success. So here is how to build this into a simple protocol. Morning 10 to 15 minutes of walking with a few brief, faster bursts to send sheer stress signals to your endothelium. Midday or early afternoon, drink your stem cell mimic potency smoothie. Evening, keep dinner reasonable, more plants, less processed fat and sugar, in line with the plant-forward dietary patterns tied to better ED outcomes. 5 minutes of gentle hip pelvic stretching and slow breathing before bed to reduce sympathetic tone and improve overall circulation. Run this for 30 days and track morning energy. Ease of getting and staying hard with or without meds. How often you wake with any kind of erection, even partial. What might you realistically see? Nutraceutical and diet trials do not talk in miracles. They talk in percentages and points. In the citrulline study, about 50% of men with mild ED improved to normal hardness in a month. In flavonoid and plant-based pattern studies, higher intake men had 9 to 21% lower ED risk, and Mediterranean-type diets improved erectile scores in men with metabolic syndrome. Case reports of whole food plant-based eating have documented reversal of ED in some men along with improved lipids and weight. If your ED is mild to moderate and largely vascular, and you combine this drink with better movement and eating, it is entirely realistic to expect stronger, more reliable erections. Shorter time to get hard. Less fear of losing it midway. If your ED is severe, long-standing, or complicated by nerve injury or major disease, this protocol will still support your vessels and tissue and may make any medical or regenerative therapy you choose more effective, but it will not replace them. Safety and final reality check. For most men over 50, these ingredients are safe, but a few cautions. Kidney disease or serious liver disease, high doses of amino acids or concentrated juices may not be appropriate. Talk to your doctor. Diabetes, pomegranate, and berries still contain sugar. Keep portions moderate and factor into your carb budget. Blood pressure meds or nitrates, dietary nitrates, are generally safe, but if you are on nitrate drugs for the heart, always clear supplements with your cardiologist. Allergies, avoid any component you know you react to. Most importantly, if your erections have crashed suddenly, you have chest pain, shortness of breath, or other red flags, you need evaluation, not just a smoothie. This drink is not a substitute for a doctor. It is what a smart doctor wants you sipping while you both work on the rest. So the next time you see a glossy ad for a stem cell ED clinic and feel that mix of hope and skepticism, remember this: you may or may not ever choose injections or lab-grown cells. But starting tomorrow, you can absolutely choose to feed the cells you already have. Blend your drink. Drink it like a man who still expects his body to respond. And give your potency the daily, quiet, regenerative support it has been missing for years.